Hi, thank you for taking the time to watch our presentation, What is Health Research and How Do I Get Involved? Partnering in Patient-Oriented Research. This presentation has been co-developed by the Alberta Strategy for Patient-Oriented Research, or SPOR, Support Unit Patient Engagement Team. My name is Sandra Zelinsky, and I am the lead patient research partner for the Alberta SPOR Support Unit Patient Engagement Team. I have been living with a chronic disease my whole adult life, having been diagnosed with Crohn's disease when I was 19 years old. I am also a breast cancer survivor, and it is my lived experience that motivates and inspires me to work in health research. In this presentation, I will be sharing more information about patient engagement in health research and patient-oriented research, and how you can get involved. So I'm going to start off by doing a land acknowledgement. We would like to take this opportunity to acknowledge the traditional territories of the people of the Treaty 7 region in southern Alberta. The city of Calgary is also home to Métis Nation of Alberta, Region 3. In this presentation, we will be talking a little bit about what is health research, what is patient engagement in health research, where can I learn about opportunities to partner in health research. So to start us off, let's talk a little bit about the definition of who is a patient in the context of patient engagement in health research. So a patient is an overarching term inclusive of individuals with personal experience of a health issue and informal caregivers, including family and friends. So virtually all of us. It could be community members, it can be anyone really that accesses healthcare services and or lives with any specific health conditions. So now let's talk a little bit about what is health research. Health research is a scientific process that helps researchers, clinicians, policymakers, patients, and others to learn and understand diseases, treatments, delivery of healthcare, and health systems. Research provides evidence-based information that informs changes in best practices to healthcare policy for treatment and care in clinics and hospitals. Let's talk a little bit about health research in the context of Canada. So in Canada, we have the Canadian Institutes of Health Research, which we also sometimes refer to as CIHR, which is one of the major funding bodies for health research. In 2014, the Canadian Institutes of Health Research, or CIHR, launched an initiative called the Strategy for Patient-Oriented Research, or we also refer to it as SPOR. The Strategy for Patient-Oriented Research acts as a catalyst for patient-oriented research, which we will talk about more shortly. To operationalize Strategy for Patient-Oriented Research, the Canadian Institutes of Health Research established the provincial SPOR support units, which is the Alberta SPOR support unit is one of them, as well as the 5 national chronic disease networks. We also have, in a global or international context, similar organizations that do similar work as CIHR SPOR. For example, in the United States, we have PCORI, or the Patient-Centered Outcomes Research Institute. We have in the United Kingdom Involve, or through their health system healthcare called NAHR Involve, and we have Coawatia in New Zealand, as well as many other countries have their version of patient-oriented research, or sometimes what's called in different areas patient and public involvement, consumer engagement, etc. So how can you get involved in health research? There's a couple of ways that you might want to get involved. And one way for people with lived experience of an illness or condition or healthcare experiences to get involved is as a participant or a subject in research. As a participant in health research, the research team will explain your participation and the potential benefits and harms to participation, and you will likely need to sign a consent form and fill out a demographics form. You may be asked to participate in a focus group or an interview where you would share your experiences on a specific topic or fill out a survey. As a participant in a clinical trial, you may be asked to take a new medication, provide blood, urine, or stool samples. The role of a participant is an important role, and it helps to contribute to the research data and results. Another way to get involved is as a patient partner in research. As a patient partner, you'd be working together as an active and equal research team member, contributing your valuable lived experiences, insights, understandings, and knowledge to the research planning and processes. We will be discussing patient partners throughout the rest of this presentation. So let's get into a little bit about what is patient-oriented research. So patient-oriented research is about engaging patients, their caregivers, and families as partners in the research process. This engagement helps to ensure that studies focus on patient-identified priorities, which ultimately leads to better patient outcomes. Patient-oriented research, or sometimes we call it POR, recognizes that patients have unique lived experiences, insights, and knowledge of their health condition or conditions and the healthcare system. Patient-oriented research teams value this knowledge and engages patients as active and equal team members working together with healthcare providers, decision makers, and others to conduct research that is relevant and applicable to improve healthcare. So we're going to talk a little bit about the research cycle. The CHR ethics guidance document describes each of these stages and the roles patient research partners can have at each stage. So we'll talk first, go up at the top where it says priority setting and planning. And this is really about determining research priorities that matter most to patients. And then when we go into the next few stages of the research cycle, this is really about designing the study, how the study will be carried out, and how the information will be collected, analyzed, and how the results will be shared. Once we figure those things out and we write a proposal, the proposal goes in for grant funding, usually to CIHR, but there are other funding opportunities or funding agencies that researchers may apply to. And so the researcher will submit the proposal for funding and then wait to see if they receive the funding. If they receive the funding, then they will go into doing the research. So data collection, if you look over towards the left-hand side of the cycle, you'll see data collection, which is about how data will be collected. For example, sometimes it might be in the form of a survey, an interview, or focus groups. And then once we have that data, we do data analysis, which is about organizing and understanding the information collected. Once we have all that information sorted, we then write that up. We have the results from the research, and we go into the areas that is called knowledge translation and dissemination, and that's really just about sharing the information of the study results. And these can be done in various ways. It can be done through academic papers or conferences, but it can also be done, for example, on social media or in different ways that would access patients and their families. So for the end users or the people that matter most. And then once all of that's done, there's usually the implementation and evaluation of the results. So putting these results into practice and understanding what worked well and what could be improved on. And then we may find new information that we may want to research or may go into a new research project based on that. So we'll go into talking a little bit about patient-oriented research teams. So these are really what we'll sometimes call multidisciplinary teams. Patient-oriented research projects are carried out by research teams that include many individuals with various expertise that have different scientific knowledge, experiential knowledge, and expertise. These team members can include clinician researchers, healthcare providers, government, organizational, and industry stakeholders, industry being pharmaceutical companies, It can be patient partners as well as their families and friends and community partners or community members. So let's talk a little bit now about what is patient engagement. So patient engagement is meaningful and active collaboration in governance, priority setting, conducting research, and knowledge translation. Depending on the context patient-oriented research may also engage people who bring the collective voice of specific affected communities. And this is a definition by CIHR SPORE. Also, by CIHR SPORE, we have the 4 guiding principles of patient engagement. And these guiding principles are inclusiveness, support, mutual respect, and co-build. These 4 guiding principles are the foundation for meaningful engagement, and it is recommended that all 4 principles are put into practice by all research team members for successful patient engagement. We will go over each guiding principle, starting with inclusiveness. So inclusiveness is when patient engagement in research integrates a diversity of patient perspectives and research is reflective of their contributions. So for example, people with lived experience of a health condition or disease and or of the healthcare system are bringing their lives into this. And we want many perspectives. We all have different journeys and things that we go through, even though we may live with the same disease. So we want to bring multiple perspectives and insights and experiences that people have had together to work together with the research team. So then let's talk about support. And support is when adequate support and flexibility are provided to patient partners to ensure that they can fully contribute to discussions and decisions. This means creating safe environments that promote honest interactions, cultural humility, training, and education. Support also implies financial compensation for time and their involvement. And then we have mutual respect, and mutual respect is when researchers, practitioners, and patients acknowledge and value each other's expertise and experiential knowledge. And lastly, co-build is when patients, researchers, and practitioners work together from the beginning to identify problems and gaps, set priorities for research, and work together to produce and implement solutions. And why is diversity important in patient engagement? So really, let's talk about what diversity is first. And diversity refers to a variety of people that come from unique backgrounds, lifestyles, social experiences, sexual orientations, different genders, ethnic backgrounds, religions, etc. Patient-oriented research aims to include and collaborate with as many diverse perspectives and experiences as possible. Some communities are sometimes missed because of barriers such as time, finances, computer and internet access, languages, or feeling uncomfortable in research spaces. And really, when it comes down to is we all need to work a little harder to include everyone in health research. So now we're going to talk a little bit about the roles for patient partners in health research. So when patients act as partners in research and research-related activities, they are dedicating their time and expertise and adding value to the overall project, similar to other members of the research team. Patient partner roles may include participation on governing boards or committees, working together on survey design for a study, co-developing the research methodology with a researcher, taking part in priority setting activities to determine new areas of research, and collecting and or analyzing data, informing ways results are shared, co-authoring on journal publications, and co-presenting at conferences and other events. When patients act as partners in research and research-related activities, they are dedicating their time and expertise and adding value to the overall project, similar to other members of the research team. So when partnering in patient research, when partnering in patient-oriented research, we recommend that the research team budgets and offers compensation to each patient research partner for their time and contributions. When patients act as partners in research and research-related activities, they are dedicating their time and expertise and adding value to the overall project, similar to other members of the research team. Offering payment to patient partners who undertake this important work helps remove barriers to working together in research and helps make research more equitable and diverse. Compensation is offered to patient partners for time and contributions of their lived experience expertise when partnering on health research project. I'll just talk a little bit about reimbursement as well, because it's a little bit different from compensation. Reimbursement is meant to cover direct expenses of engaging in a project. For example, if you have to pay for parking or travel to get to and from a meeting, or childcare, then those would be expenses that you would incur that should be reimbursed by the research team. Not all projects are funded, but may offer other benefits such as training, as one example. So we usually recommend that there's conversations about compensation and reimbursement with each individual patient research partner. And that these conversations happen at the very beginning of a research project. Compensation options should be discussed individually with each patient partner. It is important for patient partners to be included in making decisions about how or if they would like to be compensated. So you might be wondering, do I need special skills or training to join a research team? So there's no formal training or skills needed to become a patient partner. You bring your valuable lived experience, perspective, and expertise to research projects that matter to you. Many projects offer support and training. There are also several free online courses to learn about patient-oriented research. These are included in the AbSPORU Patient Engagement and Patient-Oriented Research Resources package attached to this module in PDF form. So if you want to go and look into, we have publications, we have webinars, we have podcasts, and all kinds of different resources to learn more about patient-oriented research or the strategy for patient-oriented research. And here's just a few examples of some of the training and resources and opportunities that are available. So for example, we have, we as the Alberta SPORU Support Unit have Foundations in Patient-Oriented Research and the e-learning modules. There is a national network called ChildBright, and they have their Porch modules, so patient-oriented research curriculum and child health. There's also what we call TCPS2 course. This takes about 3 hours. It's online. So that's called the Tri-Council Policy Statement on Research Ethics. It's actually an interesting course, and it's free, and then you get a certificate at the end of it. And then there's the Family Engagement and Research course that was developed by CanChild, another national network. And so these will also be available in the patient engagement resources, that the PDF that I was talking about. So another program that we have for people with lived experience, this is a little bit more intensive. I graduated from this program in 2014, and it was really kind of the catalyst or the foundation of what got me involved in doing this work. So it's been almost about 10 years that I've been doing this work for. And so this program is called Patient and Community Engagement Research, or we also call it PACER. There's a lot of acronyms in healthcare. So this is called the PACER program. This is a 12-month certificate program offered online through the University of Calgary Continuing Education and supported by the Alberta SPORU Support Unit Patient Engagement Team. Usually these teams that take, or if you take the course, it's usually sponsored by a research network or sometimes Alberta Health Services or different organizations. And these teams are usually made up of 4 to 6 students. They learn participatory health research methodology and skills and carry out a patient-led peer-to-peer qualitative research project, so from start to finish. It gives a great foundation to learning about research and how to do research. So we're going to learn about opportunities to partner in health research. So if you're interested and you want to sort of go in, get involved in some of this work, there's a few different ways that you can do this, and it depends where you're located, but there's lots of ways. There's lots of different platforms across Canada and places where you can find opportunities to get involved. In Alberta, we have our website, the Alberta Strategy for Patient-Oriented Research, so absporu.ca website. And when you go to this website, you'll find resources, you'll find more information about the strategy for patient-oriented research, you'll find training opportunities, research services, and if you go to the patient engagement section, you'll also find opportunities to get involved. It'll take you to our Albertans for Health Research website, where this is like a registry, basically, where patients can become members and researchers can be members, and researchers will post opportunities looking for people to partner together in health research. So this is one way, and I'll show you now what albertansforhealthresearch.ca looks like. So you can also just go directly to this website. So here on the left-hand side of the page is the opportunities that are currently available. There you'll see we have some of our social media links here. We're on Twitter and Facebook, also now Instagram, although we're pretty new on Instagram. You can fill in an application under this. I would like to be involved here. Fill in an application. What this will do is it'll put you on an email list, and then opportunities as they come up, as researchers post opportunities through our Albertans for Health Research website. Those opportunities will come to you by email, so you can read about them and decide if you want to reach out to the researcher to partner with them or work together with them in their research project. You can also take your phone camera and just scan the QR code, and it'll take you directly to that website. So in conclusion, patient engagement is a powerful way to improve research outcomes, make research outputs more meaningful to patients, and strengthen healthcare systems. You are not alone. The Alberta SPORU Support Unit patient engagement team is here to help. So feel free to reach out anytime if you have any questions, if you want to connect with one of us via Zoom and have a meeting and just get to know somebody from our team or a couple of us from our team. Reach out. We're here to help, and we're here to answer questions or connect you with other people if you're looking for specific opportunities. So I'd just like to acknowledge our team. So Dr. Maria Santana is the lead. We have Paul Ferry, Ingrid Nielsen, Sadia Ahmed, Matt Luzanteles, Simpson, Tiffany Barbosa, and myself. And then these are funding partners. And if you would like to connect with us, our email is on the left corner there. So peplatformab@gmail.com. We also have our Facebook, Twitter, and our absporu.ca website. So thank you so much for listening, and take care.